guys, and welcome back to our final video number 3, where we're going to be talking about patient education. Now, we've been talking about it here and there, but I want to kind of go a little bit more deeper in this video. It's not going to be as long as the other videos, but we are going to talk a little bit more in depth about things to keep in mind when we're educating our patients over insulin. Self-monitoring and clinical follow-up. This is so vital, okay? And to some, this may be a no-brainer, but you would be surprised how many patients are on insulin, multiple injections a day, and they don't know what their numbers are. We have to have these conversations with them, and we have to set that as an expectation. Not only do I need you to check your blood sugars at home, I need you to bring that log in when you come to see me so we can discuss them and we can adjust accordingly. When it comes to diabetes education and management, we have to expect our patients and give that expectation to them that they are going to participate in their care. We cannot carry this burden on our own. And even if we wanted to, guys, we can't. Okay, it's their health, and people have to take an active role in their health. And really, that's the only way that we're going to be able to get the great outcomes that we want and to get those better outcomes. Okay. Now, a good place to start, a good practice, is having them check their blood sugars about 2 to 3 times a day. I say, especially at the beginning, about 2 to 3 times is a good place to start. You may want to kick it back to about 1 once they get at goal. But when you're initiating that insulin, you do need to know where they're at with their fasting blood sugars. Okay, so when they get up in the morning, you need to see how high they are. And that's honestly how we know how to titrate. Okay, that's how we know how effective the dosage is. Okay, now if they're on pre-meal or prandial insulin, it's a good idea to have them take their blood sugar at their largest meal. Okay, what is your blood sugar running around that time? And then also, thirdly, possibly post meal, about 2 hours after. Now, like I mentioned in the last video when I was talking about titration, that's the only way, guys, that we're going to know if we need to titrate up or if we're at a good dosage. Okay, so you see how vital those blood sugars are to not only your patient but to us. Now, you typically are going to want to follow up with them every 3 months. This shouldn't be new to any of us until they get to goal. And then actually, once they get to goal, you probably, if you want to, because you have to take it case by case, patient by patient, you may want to kick them back to every 6 months. We're going to do some follow up, but that is at your clinical discretion and what is going on with your patient. And then also, guys, keep in mind that you want to keep following up with them with any changes. So if there's any new complications that come up, any transitions in their lives, you want to make sure that you're having follow up with them. You're never going to go wrong following up with your patients. So this is a time where, hey, if you want them to come in every 3 months, hey, come in every 3 months. But again, use your clinical discretion. Signs and symptoms of hypoglycemia. Now, this is a biggie, guys, and we know this, okay? I'm not telling you anything that y'all don't already know, okay? But immediately when you're starting someone on insulin, and if it's somebody who's been on insulin for a while, you want to continue to remind them of the signs and symptoms of hypoglycemia, okay? That would be your headaches, your shakiness, your irritability, anxiety, nausea, vomiting, sleepiness, pallor, meaning that they get pale. These are the things that you are going to want to educate your patients initially and continue to educate them over, because we want to make sure that we don't have any bad situations happening. Of course, you want to give them a plan of action if they are experiencing hypoglycemia, maybe taking some orange juice, having juice on hand, having a small snack at their bedside, always having something around them, on them, that if they're driving, they have something that they can eat quickly to get that blood sugar back up.